All right, so I guess we'll go ahead and get started. I want to thank everybody for coming out tonight and participating in the Small Ruminant Winter Webinar Series. We appreciate you guys being here tonight. So we'll go ahead and get started with Dr. Weaver first, and kind of some housekeeping things. If you guys don't mind keeping your mics muted until the end of each presentation, and then we'll have some opportunity for some questions. You can feel free to type them in the chat and shoot them our way, and we'll kind of moderate the chat, and kind of at the end we'll call all those questions. If you want to, you can post in the chat where your name or where you're from and your location. But yeah, we'll go ahead and I'll go ahead and turn it over to Dr. Weaver.
Sounds good. Let me get my slides shared here. How does that look?
Looks good.
Perfect. Sounds good. Well, thanks everyone for joining this evening. I'm going to kick things off here, and then we have Dr. Harrison Dudley with us, who's a veterinarian in Eastern North Carolina, and he's going to follow up with some discussion about treatment options for hoof issues. I am not a veterinarian, and so I'm not going to tell you specifically what to treat with or how to treat. I'm going to let him cover that, and I'm going to talk more so on the preventative side. So, how do we prevent hoof issues in the first place? And, if we do have some issues, what are some management practices we can utilize to help eradicate those issues and minimize long-term effects from hoof issues? Because anyone that's been in the small ruminant business for any amount of time, I'm sure has had some issues with them in the past. It's really no fun to deal with. And it's something that if we can eradicate from our flock or our herd, really that's going to be the best methodology in terms of minimizing labor efforts and making sure we ensure animal health and animal performance long term. So with that, when we think about those issues that can go on with the hoof, we typically talk about foot scald or foot rot, and they are two different things. And this flow chart, Dr. Earhart at Michigan State put this together, and I think it does a good job of kind of summarizing some of those differences. Essentially, any moisture, any trauma to that hoof. So if we think about where animals are housed, and we want to make sure they're on relatively dry ground. Sometimes we just can't avoid having them in wetter areas, but those wetter areas are going to make those animals more susceptible to developing some foot issues. And so if we keep them on dry ground, keep them on clean ground, that's going to help. But excessive moisture, trauma to that interdigital space, so that space in between those hooves, can result in some irritation there and that infection. And so we have that softening, the damage to that interdigital skin, and then the invasion of that Fusobacterium necrophorum. So that bacteria alone is going to result in just what we call foot scald. It's the milder form. You'll still see animals limping. They'll maybe holding a foot up, or they're not putting full weight on one or more feet. When you open up and you separate those hooves, you'll see some open and exposed tissue there between the hooves, and that would be our basic foot scald. And that Fusobacterium, it's actually found in the intestines of the animal. It's fairly prevalent in a pasture system. So that bacteria alone can cause that foot scald. It's annoying. It's a pain to deal with. But it's a little more common. What we really want to avoid is the development of a full-blown foot rot, the much more severe version. When we think about foot rot, we think of actual necrosis of that actual hoof tissue, and in a situation that is much harder to treat, it's going to take a lot longer for that animal to recover, is going to result in much more severe impacts in terms of animal performance. And so to get actual foot rot, it actually takes the interaction of two bacteria. And so we can have benign foot rot or the virulent foot rot. And both foot rots are caused by the interaction of those two bacteria. The only difference between the benign and the virulent is a gene that is expressed in that second bacteria, and that APRV2 protease is a little bit more intense and causes more damage relative to the APRV2 that results in that benign foot rot. So we have that one bacteria. We have Fusobacterium necrophorum that's around, that's in our environment. That one's going to cause foot scald when those animals are exposed to lots of moisture and that potential damage to that interdigital space. And then you have another bacteria that comes in. Once that Fusobacterium, maybe that one's kind of got it started. And hopefully we can get it treated at that point while it's still scald before it evolves into that full-blown foot rot, where we have that second bacteria that comes in that results in a much more severe type of infection. Both of these bacteria are anaerobic, which means they do not like oxygen. And so when we think about prevention and treatment, we think about, if these bacteria are exposed to oxygen, exposed to the air, they will die. And so, having that hoof regularly trimmed, minimizing opportunities for those anaerobic bacteria to proliferate are going to work to our advantage. So foot issues, like many other diseases that we talk about with our small ruminants. This is one of my kind of favorite quotes I go back to, especially when I talk about health-related issues. An ounce of prevention is worth a pound of cure. The little things you can do up front and taking the time when you see that animal limping, address it that day. Don't wait and come back a week or two later, because there's probably going to be that many more animals limping, and it may have evolved to a more severe form by that point. So do what you can up front. Be attentive and timely in terms of addressing these types of issues, and try to minimize the issue from even taking place in the first place. And so a lot of this comes back to biosecurity. And so biosecurity, that's where we'll start in terms of prevention and management. Ideally, we don't let it on our farm in the first place. We may have some of that Fusobacterium on our farm already. That's fairly common. What we don't want is that secondary bacteria. That one, fortunately, has a fairly short lifespan. And so if we do a good job with biosecurity, we can minimize that second bacteria from even coming on our farm in the first place. And not having the opportunity for that more severe form of foot rot to even develop. And so, how do we keep it from coming on the farm? So really think about your visitors. Who's coming on your farm? Who's interacting with those animals? Who's going in the pens? Who's going in the pastures? And if they are, what are they wearing? What do they have on in terms of shoes? Are their shoes clean? Have they worn their shoes on other farms? Have they worn their shoes on their own farms? Do you have some boot covers maybe? And that's an extra, fairly inexpensive. You can keep those around, have them put those on before they get out of the truck. And that's one way to make sure that they're not spreading those bacteria or bringing those bacteria onto your farm. If you want to go even one level higher, think about, where their truck or their car has been, the tires, their trailers. If they've been driving through their pastures and they come over and drive through your pastures, there is an opportunity there for them to spread that bacteria, bring that bacteria to your farm. Foot trimmers. If you've been, maybe you share some hoof trimmers, maybe you've been at an educational program or something like that. Know where those hoof trimmers have been. Take some Chlorohex, disinfect those hoof trimmers between uses. That can even be relevant for your own hoof trimmers, within your own flock. Maybe you've been treating an infected population, and maybe you're going to go and do some regular kind of routine hoof trimming on some animals that may not be infected, maybe in a different management group. You're going to want to clean those, because you don't want that to be an opportunity to pass that bacteria onto animals that otherwise are not infected. Shearing equipment. If you're raising wool sheep, that maybe is maybe not direct impact to the hoof per se, but it still could put that bacteria in the environment. So where have your shearers been in the past? Are they disinfecting their shearing equipment between farms and minimizing? And that's biosecurity related to shearing is not just relevant to hoof issues. That would be relevant to a multitude of different diseases as well. I mentioned boot covers already. That's kind of an easy, quick, good biosecurity practice to put into place. Relatively inexpensive. Think about movement areas. When those visitors come on your farm, where are they going? Are they walking down concrete center aisles? Are they walking into pens? Are they walking out into your pastures? How can you control what you can control? There's a lot of things we can't control. So think about, what practices can we put into place um, to minimize or decrease the risk of exposure? What are your marketing plans? And this is going to be dependent on your operation. If you're in the youth livestock, maybe the club lamb or show goat business, and kids are coming out to your farm to look at their 4-H projects for the year. They're going to go in the pens. They're going to handle the animals, and you just need to accept that fact. Maybe make them wear boot covers. If there's a marketing plan in place, if people are going to be coming out to your farm to purchase or look at animals, maybe think about is you have a separate kind of almost like a quarantine area, or maybe, if they can stay outside of the pens. Think about where they're moving, and if they're going to be in the pens, think about how you're going to control potential disease spread in that scenario. And then think about where you've been. Where have your boots been? Have you been to the feed store? Have you been to the sale barn? That's one, it's always fun. You go to the sale barn, you drop your animals off. A lot of sale barns maybe have a little restaurant there, and you go in and grab some lunch and talk to your friends, and then you head out and go home. Well, do you have a separate pair of shoes for when you go to the sale barn and interact with all those other people and all those other animals? Maybe you're putting on covers while you're there. How are you controlling disease transfer, disease spread when you come back to your own farm? And so also be conscious of that. And that's one that's sometimes easy to forget about, where you're crossing paths with others and other animals, and how that might result in disease transfer onto your farm. And then when we bring animals onto the farm, maybe we have a closed flock or closed herd, and that's certainly one way to do it. But from a genetic standpoint, and bringing in outcross genetics, unless we're going to utilize maybe AI technology, and we're probably going to bring maybe, at least at the minimum, we're going to bring males onto the farm. We're going to bring rams or bucks onto the farm, and so we're going to make sure we want to quarantine those animals. And the general recommendation is at least 4 weeks. Have a separate pen for those animals, no nose-to-nose contact. Make sure that we can completely isolate those animals, observe for signs of diseases, not just hoof issues, but other diseases as well, and make sure those animals are free of contagious diseases before they're introduced to the rest of the flock or the herd. It's also encouraged that you use a 10% zinc sulfate foot bath. You run those animals through. General recommendations about twice in that 4-week period, just to make sure that they are completely, they might not be showing any symptoms, but they might still have some bacteria there. Make sure that those are killed, and that those animals are clean when they're introduced to the rest of your flock, your pastures, the rest of your system. So a good quarantine practice can help minimize that disease transfer as well. In terms of nutrition, again, a good nutrition program results in a good immune system, and a good immune system allows your animals to do a better job of fighting off those diseases and those infections. And so mineral nutrition is a big part of that, and having a good mineral program that's specific to the species that you are raising can make a big difference in terms of immune health and reduction in disease incidence. We recommend using a free choice mineral, a loose mineral. You'll want to, if those animals are housed in confinement. So if they're in a barn, if they're on harvested forages, if they're on hay, starting about this time of year, until we have green up in the spring, we're going to want to make sure those animals are on some supplemental vitamin A, D, and E. A, D, and E would be our essential vitamins. The animal does not synthesize those vitamins on their own. Those need to be supplied in the diet. If they're out grazing fresh green grass in the summer, they're getting those vitamins on their own. If they are on harvested forages, harvested feeds, if they're housed in a barn, then we're going to need to make sure that those essential vitamins A, D, and E are supplied in their diet. Like I said, we want to make sure our mineral program is species specific. Goats do have a requirement for more copper than sheep. Sheep do have a copper requirement. It's just very low. And so sometimes we run into some problems where, we have maybe we have sheep and goats together and we're feeding them a sheep mineral. Well, the goats are coming up short on their copper requirement, and they can have some issues as a result of that. So we want to make sure we address that and make sure we have a species specific mineral and minimize the incidents there. There's some several different options in terms of getting mineral to those animals. We can purchase a pre-mixed, commercially available loose mineral. Go to the feed store and find a mineral that's specific to the species you're raising. It's already pre-mixed. You can just put it out in mineral feeders and be done. You may also opt to purchase a complete feed. So maybe you're feeding a pelleted feed that has a mineral and vitamin pack already in it. And so the big thing there is just making sure you're feeding enough of it. We might be feeding 1/2 pound a day. We might be feeding 2 pounds a day. Well, if the vitamins and minerals are included at the same concentration, if we're only feeding 1/2 pound a day, they're not getting nearly as much as if they're feeding 2 pounds a day of that feed. So if you're relying on a complete feed to provide the vitamins and minerals for your flock, make sure you read the label and feed according to labeled instructions to make sure those animals are getting enough of the vitamins and minerals that they need. It is always a good practice, even if you're feeding a feed that has a mineral pack in it, to provide a loose mineral for them as well. It can't hurt to do that. And so it may be good to do both. And we can also, an alternative would be, we can buy, there's some companies that'll make a vitamin mineral premix, like a concentrate. And you can actually get the mineral pack and the vitamin pack separate. So this is a system that we use within our North Carolina sheep system across all of our research stations. We get a mineral concentrate, we get a vitamin concentrate. And then during the summer months, we just feed the mineral. And then during the winter months, starting about now, we'll start including the vitamin pack in with that mix and provide both. And so we just take that concentrate, we mix it with a 50-pound bag of just plain white salt. And we were able to provide the mineral in that way. So a couple different options out there for you to make sure those animals are getting the minerals that they need. So back to kind of more specific foot scald, foot rot management. Grazing can be a part of that. The Fusobacterium, remember that one only causes foot scald, that it infects that interdigital space. If all you see is some necrosis, some exposed tissue there between their hooves, that's just foot scald. This bacteria is readily found in your pasture soils. The interaction with that secondary bacteria, which is really hard to pronounce, at least I have a hard time pronouncing it, causes that more severe foot rot. The fortunate thing with this bacteria is it only lives in the soil for about 10 to 14 days. So it actually has a relatively short lifespan. It can survive in the hoof for much longer though. So if you get animals that are infected and you don't treat it, you don't do anything about it, maybe you buy in some animals and they've been infected, it can hang out in that hoof for a long time. And so that's where, good quarantine practice, foot bath before introduction, and things like that are definitely necessary to make sure we kill off that bacteria so we're not bringing it onto our farm. But knowing that it only lasts for 10 to 14 days in the environment, we can utilize that to our advantage in our grazing system. So, if we just rest our pastures, so when you're finished grazing a pasture, and this is, you're probably going to want to rest your pastures for more than 2 weeks anyway, in terms of forage regrowth opportunities. But if we rest those pastures for at least 14 days, should result in the removal of this bacteria from those pastures. The big thing, and I think where most people run into problems here, is that they don't make sure all the animals are clean and free of this bacteria before reintroduction. So, you might wait 30 days to come back and regraze. Well, if there's just one infected animal in that flock, when they're put back on that pasture that's been rested for 30 days, all of a sudden that pasture is infected again. So you need to make sure that, you rest your pastures and make sure everyone's clean, free of the bacteria before reintroduction of the flock to that pasture. We can also utilize dry lots, sacrifice areas. We can utilize that to our advantage in some scenarios, especially during maybe an eradication program. But we also need to think about those areas where we have, a lot of animals in a confined, tight space. There has increased opportunity for, mud, fecal material accumulation. And so we want to minimize those wet areas because, again, those wet areas are going to cause that irritation, soften that tissue, and allow those bacteria to take advantage of that opportunity. So maybe if we have some low-lying areas and some dry lot sacrifice areas, maybe we use some gravel to fill those in, allow drainage to take place and keep those animals from standing in the mud. When we're thinking about, okay, where are we going to maybe build a sacrifice area? Maybe we're going to put a a dry lot space. Make sure you select areas that are well drained. Maybe they should slope a little bit, allow that water to run off of that area and not just pond. Make sure that water is going to go away, and that we minimize the accumulation of moisture, and resulting mud that would potentially lead to more foot issues. If you're using a covered area, maybe you're in a lean-to or something like that, we can bed that area regularly to help keep that environment dry. Use some straw, corn stalks if you have those. And that's going to absorb some of that moisture. Fresh bedding, frequent bedding is going to keep that bedding very dry, clean, and minimize the development of foot issues. So hoof trimming is a big part of this, and making sure those hooves stay trimmed, and minimize the opportunity for these anaerobic bacteria to proliferate. And so this image shows, on the left there, we have the hoof before it was trimmed, and on the right, we have that hoof after it was trimmed. So you can see that hoof wall grows up around the bottom of the hoof. And so the heel, those walls of the hoof are going to continue to grow. The front of that hoof is going to continue to grow out. And as they grow, that hoof wall folds over the base of the hoof. And so where we run into issues is, as that hoof wall folds over, dirt and bacteria can get up underneath that. Well, now you have a hoof that's kind of closed in. You have dirt up underneath there, and now you have a very favorable anaerobic environment for the proliferation of these bacteria that are going to cause foot rot. So by keeping that hoof regularly trimmed, keeping it open and exposed to oxygen, that's going to allow or minimize, I should say, the opportunity for these bacteria to establish. So on the right, you see that hoof wall was trimmed down. The bottom of the hoof is nice and level. That toe is trimmed in some. A little bit has been taken off the heel. You don't want to take too much off the heel. But make sure that there's, anywhere where it's kind of folded over and there's opportunity for dirt and debris to get up underneath that hoof wall, we're going to want to trim that down and level that out. And so hoof trimming, it's a little bit of an art, takes some practice, takes a little bit of experience, but it's certainly not too hard. And it's something that we're going to at least want to check our animals on a somewhat regular basis. A lot of the needs in terms of hoof trimming come down to what environment our animals are housed in. If you're on really rocky ground, if those animals are walking a lot, if they're on concrete, if they're on gravel, if they're walking up and down driveways and things like that, they're going to wear down a lot of those hooves on their own, and you may not need to trim them very often. If your animals are always in really soft ground and pasture, if they have very little exposure to any rough areas, those hooves are pretty likely to grow relatively quickly. Nothing naturally is going to really wear them down, and they're going to require more frequent trimming. Sometimes white hooves tend to be a little bit softer than the black hooves, and may require more frequent trimming on soft ground. And so keep that in mind, and you kind of have to learn your animals, your environment. And in some cases, they require more trimming. In some cases, maybe less. I know plenty of folks that never trim hoofs, but they're also, their flocks are frequently moving. They're on relatively rough terrain. I know other folks that, trim or at least check hooves once every, month or two. Some of this is also a function of flock size. If you've got 5 or 10 animals, it's pretty easy to check them every few weeks. If you've got 500, then if you can get them done once a year, maybe that's a win. And so it really depends on how many animals you have, your handling system. Do you have a tilt table? Are you flipping them over and doing them that way? And it's a little bit of balancing your labor, resource availability with the needs of those animals. But if we can keep those hooves open and exposed, level and not overgrown, that's certainly going to minimize the potential development of hoof issues. But we kind of need to take into account some of the other factors that play into how frequently we can trim hooves. So in terms of selection and genetics, we can also utilize that to our advantage. Unfortunately, in the United States, there's no commercially available genetic tool for selection for foot rot resistance. We don't have an estimated breeding value for it. We don't have any genetic markers for it available here in the United States. There is a test in New Zealand, but we don't have one here in the US at this point. So really where we can utilize genetics is in terms of sound culling practices. So we're going to isolate and cull animals that show symptoms. And the severity to which you want to take that is up to you. There's some folks that, you see a limping sheep, they're on the trailer. There's other folks, maybe you give them a time or two. And if they don't cure or they're repeat offenders, then they go on the trailer. The intensity in which you want to select for this trait is up to you. Obviously, the more intense you select for it, the faster the progress you're going to make. But at the same time, you may lose 80% of your flock in trying to identify those that don't have any issues. But long term, there could be a lot of benefit to that. So really, it's up to you. Identify those animals that don't require treatment, that don't require as frequent hoof trimmings, and keep replacements out of those individuals. And so there's some opportunity there. Cull those that you have problems with. Keep those that are sound and functional and you don't have any issues with. Long term, that you should be able to make a little bit of progress in that regard. I've mentioned the black hooves versus the white hooves. There's some anecdotal evidence. We don't have a lot of concrete scientific data on this, but there's some anecdotal evidence that those black hooves are a little bit harder. They have fewer hoof issues. There, it's not saying I've certainly seen hoof issues in black hooves, but the frequency is maybe a little bit less than what we see in animals that have white hooves. Some breeds naturally have one color or the other. So Dorset sheep, all polypay sheep, they're all going to have white hooves. St. Croix going to have white hooves. Black hooves, Suffolk sheep are going to have black hooves. Texels are going to have black hooves. Katahdins are kind of a unique one because they can have both. Some Katahdins have white hooves, some have black hooves, some have a couple white and a couple black. I know producers out there are actively selecting for sheep that have black hooves within the Katahdin breed. And so maybe that's something that you want to pursue. I'm not going to say it's going to, that alone will not eliminate all your hoof issues, but it might help. And it's probably not going to hurt. So there's some opportunity there from a genetic standpoint to make some progress and remove those animals that are overly susceptible and causing repeat problems with hoof issues. And then finally, I'll kind of wrap this up, covering an eradication program proposed by Dr. Earhart in terms of if you're persistently having problems and you just want to get rid of it once and for all and not deal with it anymore, this is one methodology that may be able to help you with that. It takes some time, takes some labor, takes some resources, but long-term could certainly be beneficial. So you're going to go through your flock and you're going to sort that flock into two different groups. So one group is going to be the group that has all the healthy feet. So go over, flip every sheep, check every hoof. If there's no signs of hoof issues, scald or rot, we're going to put those in one group, and then we're going to make a second group, and that group is going to be the ones that are symptomatic for scald or rot, and that's going to be what we call our infected group. So the exposed group is the group that is healthy. They've been in the same pasture with the infected animals, so they are exposed. And then the second group is going to be our infected group. And so with that exposed group, these are animals that are they're not showing, any symptoms. These are animals that appear healthy, but they've been exposed. They've been in the same environment. We're going to trim hooves on those. We're going to soak in a foot bath for greater than 15 minutes, at least 15 minutes. We're going to move those animals to a clean pasture that has not been infected or not had infected animals in it, I should say, for at least 2 weeks. So we're going to go through that exposed group, trim, soak, put on a clean pasture. 2 weeks later, we're going to bring those animals back in, do the exact same thing. During that time period, if you see any symptomatic animals, they're going to be moved to the infected group. After 2 rounds of treatment here, so do it once, wait 2 weeks, do it again. After that exposed group should be pretty clean and free. Keep those on clean pastures. Don't let them come back to a pasture where infected animals have been within 2 weeks or within the previous 2 weeks. Your infected group, so that's the group that has active foot scald, foot rot. You're going to trim their hooves. You're going to treat those animals with an antibiotic as prescribed by your veterinarian. And so Dr. Dudley will probably talk about that here in just a minute. You're going to soak those animals in a foot bath for at least 60 minutes. So quite a long time. And so you're going to put those animals in a foot bath for 60 minutes once per week. You're going to keep them on dry ground, preferably in a dry lot. Keep them on very clean ground, dry ground, where we're going to minimize an increase in severity of that disease. We're going to examine and trim those hooves monthly. And then cull any animals, we're going to wait about 8 weeks, so 2 months of doing this, and cull any animals that have not responded after 8 weeks. So after 8 weeks of soaking every week, trimming hooves every month, if they still are showing symptoms, they're not going to get any better. They need to go down the road. You're going to cull those animals, get them out of the flock. And at that point, those animals will have seen a repeated treatment over a significant period of time. They should be clean and free of the bacteria. These animals can then, go back and be commingled once again with the other group and put on clean pasture that, at this point has not been seen in an active infection in over 2 weeks. And then as a routine kind of preventative practice, we're going to soak the flock in a foot bath every 6 to 8 months. And so, good time to pair these up with, kind of other routine management practices. So maybe you're bringing animals in to preg check. Maybe you're running through to vaccinate or something like that in the spring. Maybe after shearing or something like that, they go into a foot bath. Think about, you don't need to bring the flock in at a separate time just for this. Think about how you can pair this up with some other times you're already handling those animals. So just a few additional resources. I've referenced the Michigan State material a couple times here. They've got a really good extension publication on some of this. And then Purdue has a really good extension publication. So I have both of those links here. And this recording will be posted after the presentation here tonight. It might take me a few days to get that done, but it will be available. And so you can find these links there. We might be able to throw them in the chat too. And so with that, I'll just have a quick mention here of our next webinar coming up January 9th on opportunities for sheep and solar grazing. If you found the registration for this webinar, you've probably seen the registration for that one too, but I just wanted to mention that real quick and make sure everyone was aware of that one coming up here, our first webinar of 2025. So with that, I know it says questions here, but I think let's turn it over to Dr. Dudley, and then we'll take questions at the very end.
All right, can everybody hear me?
Yes.
I'm trying to do this from my phone because my computer is not smart enough to do it. I'm Harrison Dudley. I'm a private practitioner in Eastern North Carolina. I am not a very formal speaker, so you'll have to bear with me. I don't have a PowerPoint or anything like that. I just figured I'd talk off the cuff. Basically, the message that I would use here is that as far as treatments for hoof diseases in small ruminants, we are somewhat limited in available products. We have 0 products labeled for use in minor species. So, as far as a general statement of like what antibiotic is going to work and what is not, it's a really hard thing for me to do in an extension standpoint. That's something that has to be worked out between you and your veterinarian with a knowledge of the problem that you have on your farm. As a general tenet, there are drugs that are going to work better than others across flocks and across herds. We have data from major species like cattle, where we know what drugs are going to be a little better suited than others. But at the end of the day, there's not going to be something that you can go and look on a label if you were able to get them over the counter and say, this is what's going to work. In general, a broad spectrum antibiotic is going to be much better than a narrow spectrum antibiotic. Broad spectrum antibiotic being something like a macrolide, like Draxxin or Zactran. A narrow spectrum antibiotic being something like penicillin. But there are situations where we may try to use a combination of both a narrow spectrum and a broad spectrum antibiotic. A lot of these hoof issues are very localized infections as well, so systemic antibiotics may or may not be warranted in every case. I thought Dr. Weaver did a good job of explaining the difference between scald and actual foot rot. When you're just dealing with a topical or surface level infection, systemic antibiotics really aren't going to do a whole lot for the sore foot. Topical treatments like essential oils or other astringent products like copper tox or zinc sulfate are going to be far better suited to deal with that infection and may avoid the need for any prescription products to be used at all. But I think the main message that I want to convey, and I'll be pretty brief here, is that I think you have to have a good working relationship with a practitioner in your area, because all of these products now are not over the counter. Whereas we used to have products like Thailand and oxytetracycline available to producers, you now have to go through a veterinarian to get access to any injectable product should the situation arise. And being able to respond quickly to a problem in your herd is certainly going to be far more valuable to overall production and health of your livestock. That's pretty much all I got, unless there's any questions.
Yeah, we can open up to questions, and maybe to kind of kick it off, in terms of, I know that we have some producers from all over the place, and I think there's some state to state differences, but we do have some North Carolina producers. Harrison, if you don't mind, just for the North Carolina folks, kind of what does that veterinary client patient relationship require? What does it take to get that established? And how do you maintain that long term?
Sure. So I can speak for what my practice is, because it is somewhat of a gray area, even within the veterinary medical community. If I have been on your operation in the last 12 months and have an understanding of how your animals are managed, we have a veterinary client patient relationship. I am not one that is going to hold a producer to having me out there, any more frequently than that, because livestock species in a relationship that I'm really working hard at, in my mind, should not need that frequent of touch from me. But, I do feel like it needs to be more than just, I've been called out to do a C-section on a ewe having a problem. It needs to be, a true farm visit where I have scheduled time to be able to walk through the operation and understand goals and challenges on this operation.
Awesome. Thank you. I did see a question in the chat. How do you get your goat to stand in a foot bath for 60 minutes? And what about the same for sheep? Dr. Dudley, you have any thoughts on that, or you want me to try to tackle that?
What we've done in some of the herds that I work in, we actually just build a little box that has like a big mortar pan or an industrial sized dairy cow foot bath, kind of a poly plastic type thing that's got maybe a 4 to 6 inch lip on it, and you basically just close them in it. It's got either hog panels or something that's going to hold them there, and you just force enough in there that they have to stand in it and be still.
Yeah, I've seen kind of two versions I've seen are like the in-chute versions, the kind of the narrow pans that you can put into a chute system, and the animals walk through it. They stand there, that kind of limits the number of animals, and that gets hard, especially when you're going for that long. Having a big foot bath, especially if you have a large flock, is a lot more efficient from a labor standpoint. So that option works. And then also, as Dr. Dudley mentioned, you can take some of the larger, maybe cattle foot baths, the larger, or you can build, I've seen some folks build their own, or even pour concrete and build one out of concrete that can maybe hold 10 or 20 animals at a time. I would recommend using solid-sided panels, or wood boards, something like that, on the sides, because I've seen those animals in the middle, they're okay, they're going to stand there for that time period. I have seen animals along the sides, if you have especially if you have horizontal bars on a gate panel or something like that up next to your foot bath, they'll get a leg over, or they'll try to climb those horizontal bars, and they won't actually be standing with their feet down in the solution the whole time. So I would recommend, the vertical bars at minimum on your paneling around your foot bath, and ideally use solid sided panels to make sure they stay in there.
Oh, Dr. Weaver, we've also used like 2x6s and kind of built a pen and used panels around the outside. And if you've got a small enough group, if you're just doing a smaller group, you can actually move the animals into the foot bath, and we've used like a tarp like doubled over, and usually that'll hold it. But then you can put the animals in there before you fill it up with water, and then sometimes it's easier to get them moved in there. And then you can add your copper sulfate or whatever, and they'll kind of mix it around. But yeah, we've used 2x6s and just a simple, pretty thick tarp, just folded over in there, and it seems to work pretty well.
Yeah, you mentioned copper sulfate. Copper sulfate, works, probably safer with goats. I have heard of some folks using copper sulfate with sheep. The concern there is if they decide they're thirsty and drink some of it, zinc sulfate and just minimizing copper in the environment there around sheep is generally the recommended foot bath to use with sheep. But copper sulfate you could use with both. Dr. Dudley, do you have any preferences there? Or?
Not really. No, I mean, we always have that concern with sheep, but zinc sulfate, I think, in sheep flocks works pretty good.
There was a question, does LA200 treat foot rot? And I'm not sure you'll be able to answer that question.
Yeah. So like I said earlier, I mean, we have labels for these products in other species, and it is definitely labeled for foot rot in cattle. So as a practitioner, I would say that in situations or flocks where it has not been overused and we may have some resistance in the soil microbes that typically cause these problems, it has a good opportunity to work. But because of the over-the-counter nature of this product for several years or decades now, I do find that LA200 has a lower propensity for efficacy in places that have struggled with foot rot. But as a drug class, yes, it should work.
One more question about getting a goat to stand for 60 minutes. And I think we covered some of that. Yeah, the big thing is just having enough space for them to stand and having solid sides there to keep them from trying to climb out. Any other questions? Feel free to type them in the chat, or you can unmute yourself and ask them that way. We can get any questions you might have addressed. Okay, there's a question about, do you use LA200 like normal sub-Q, or do you apply to the hoof directly?
Oh, that's a great question. I have done both. Kind of going back to that question about whether the problem is superficial or whether it has gotten into the deeper tissues. I think there is a lot of value in using some of these oxytetracycline powders, making it into a kind of a putty that you pack into between their toes. But that is very much off-label, extra-label use of a drug, and FDA doesn't really like it.
We will also take, for like zinc sulfate. I often buy the anhydrous, the powdered zinc sulfate. And if it's just, one or two animals, if I have to treat a bunch of animals, the foot bath is definitely the efficient way to do that. If there's just one or two animals, especially if it's just at that scald stage, it's just kind of topical. It hasn't really gotten deep. I'll just take zinc sulfate and put it, sprinkle it in between the toes. And then as that animal walks around in the pasture, the moisture there in the grass kind of soaks it in. And that seems to be, that can work sometimes just to address a few cases here and there.
Absolutely.
Let's see. What do you think about the mineral buffet for goats? Oh, that's a good question. Lots of debate with that one. My general preference and my thought and opinion on that is the buffets don't work. Feed a complete mineral, all is one, loose mineral. The buffets, you end up spending a lot of money buying individual types of mineral, and maybe they prefer one over another. And then you've just spent a bunch of money to get some mineral that they're never going to eat. And maybe they need some of that mineral and they just don't like the taste of it, and then they don't get any of it. Feeding the pre-formulated complete mineral all together, make sure that they consume everything that they need all at once. I think it's more economical and it's probably healthier for the animal long term. You have any other thoughts on that one?
I agree. I do not ascribe to the theory that they know exactly what they need and will pick it. I've watched my kids at Golden Corral buffets way too often. They need something that every bite they take is formulated to be balanced.
There's a question about, do you need to rinse off the zinc solution after? Nope.
I wouldn't recommend that. No, I think it is a good idea to run them through a water bath before they get into the chemical solution to get any organic matter off of their hooves as best possible before they go stand in it. That makes the actual drug or the chemical have better contact with the actual infected skin. But that requires double the amount of hoof bath space, and is a little more challenging to overcome. Oh, buddy.
Okay, what are your all's thoughts on a good brand of minerals? I'm in Georgia, so we lack copper and selenium. I currently use Durafirm, the Concept Aid, but still have issues with copper due to hard well water. Dr. Dudley, do you have any thoughts on minerals? We use our mineral, just it's convenient. Economically it works for us. There are multiple options out there, and I'm not really an extension supposed to promote one or another. There are multiple options out there, in my opinion.
Yeah, and as a private practitioner, I don't have those constraints, but I certainly don't know that I see one works better than another. I think the important thing is the animals eat it, and that it is a high quality input type product. So you really have to work with your local reps and vendors to figure out which product is going to be best for your area. I do think that a somewhat customized blend for your area is very important, and a national prescription diet is certainly not going to be right in every situation locally.
Yeah, I would agree with that. Yeah, if you can find something regionally, locally, you're probably going to be better off. Another question, how do you thoroughly clean a tender hoof? I guess maybe what are thoughts on, how much, maybe the question gets at kind of how much hoof wall do you take away while hoof trimming? And how do you deal with one of those more severe cases?
I'll tackle that. I mean, I tend to be pretty aggressive. I want to get that necrotic hoof horn as close to hitting blood as I can get. And sometimes it's broken through and I'm going to get to the actual corium and that animal's going to bleed a little bit. But I think it is really important that all that dead spongy tissue be gone, because it's only going to harbor bacteria and, lead to further necrosis if it stays there. You have to get it down to that clean white new growth, if at all possible, even if it means taking the whole hoof wall up to the hairline or down to the corium on the sole.
Yeah, I generally take the same philosophy. The bacteria are anaerobic, so you got to get them exposed to air for it to dry out and to kill off what's there. So you want to make sure they still have something to stand on, but personally, I will get fairly aggressive with them.
Yeah, there are certainly cases where it's hard to spare the amount of hoof wall that you would want to spare, but it is better just to get it all gone.
Mm-hmm. It'll dry out and heal up.
The most common thing that I see as a practitioner is that there's not enough hoof horn been taken away.
Mm-hmm. Yeah, that's a good point. Another question, I find it difficult to give almost any medicine sub-Q. Just my experience, if I administer medication IM that says to give sub-Q, will it be less effective? This is a great question, and maybe gets at kind of methodologies for antibiotic administration and how do we make sure we get a sub-Q shot sub-Q?
Yeah, and it is certainly a difficult thing to do with animals that are, restrained. It's one thing to have an animal, headlocked and in a squeeze, but another to have it between your legs or docked. If a product is labeled for sub-Q, but it goes intramuscularly, I don't think there's any issues as far as efficacy. What it does cause is some tissue reaction where you'll have a little bit of muscle damage or fibrosis in the area that you give the shot, which long term, from a meat quality standpoint, would not be a good thing. The biggest thing that I see as far as sub-Q administration not being effective is using a needle that's too low of a gauge or too big to where the product actually leaks back out of the hole that's created. That can be overcome by angling the needle down. And once the needle is in, pulling the skin out and away from the meat to create a little pocket for that drug to sit in. And then rubbing where you pull the needle out to go ahead and get that skin to seal back over. That ensures that the product stays in the animal and is going to have a little depot effect there. So it's going to have its ability to sit there and be absorbed by the body over the amount of time that it's supposed to be. Having that animal restrained, tinting the skin if possible, or using a short needle where you're not as likely to get it deep into the muscle are kind of the key points I would take there. And then angling it down to where gravity is going to pull it under the skin rather than it having pressure that pushes it back out from a sideways or a needle poking into the skin and then injecting it up.
So then I got another question here. It came through as a direct message, but I think this is maybe a point that I may have covered earlier, but may need a little bit more clarification on. So how do we tell the difference between hoof scald and rot? What might be the easiest thing, I'm going to share my screen for 1 second, and I'm going to pull up that Purdue publication because I think it has some good pictures here that kind of describe what we're looking at here. Can you see that all right?
Yeah.
Okay, so see if I go to can you see my pointer here, my cursor? So in the image here, in that interdigital space between their hooves, that's where you're going to see that scald develop. It doesn't really get deep into that tissue. It'll just be, it's the milder version right here in the middle between their hooves. If you scroll down here, this is a more severe example. of foot rot, where you see that actual necrosis, the separation of that hoof wall. And then you look at, there's one more image down here where it's actually getting into kind of the pad there, and that the bottom of their hoof. And that's going to be that more severe foot rot. So that's going to be that interaction of those two bacteria. So if it's just in between their toes, that's scald. If it's getting into the actual hoof tissue and you start to see that separation of the hoof wall, that hoof tissue, it'll smell really bad. That's kind of a classic symptom or sign. You can, some of these animals, you can even smell them before you flip them over and look at them. You can just, it's pretty potent. And you get that really soft pad, and you get that necrosis that's happening, and you're gonna have to trim all that back in a way to open that up and air it out. Dr. Dudley, any other details?
No.
Add to that? Okay. Is additional cleaning needed after trimming? Solutions, soaps, brush tool, etc. I just use zinc sulfate after, if there is any issues, put some zinc sulfate on it. Dr. Dudley, you mentioned maybe getting them clean before they go in the foot bath. Someone mentioned getting a little abscess after they give sub-Q shots. They're using a new needle every time. But what are they doing wrong? Are they administering it too fast? Why are they getting a little abscess after that injection?
Yeah, I mean, it somewhat depends on the product that's being injected. Some of them are just more caustic to the tissue than others. We also have to remember that we're usually going through dirty hide, even with clean needles, not burred. We can take in bacteria that are on the hair, dirt that's in the hair as we're injecting. It's a very common thing, and I don't have a great solution to it.
And then there's questions. So would you just take off the wall on the side to completely open the separated area? I think that was kind of getting at what we maybe alluded to before in terms of opening that area up and allowing oxygen to get in. I will take that hoof wall off pretty far off the side of that hoof if needed to open up that area. It's already separated. It's already, it's on its way to separating. It's just going to get worse if you leave it. So, my opinion, take it off and open it up.
Yeah, I agree. I chase the black stuff until I don't get black stuff anymore.
Mm-hmm.
Sometimes that means you take it all the way to the hairline.
Yeah, I'll do the same.
I actually even have a little grinder that helps me get it even better than just the nippers can. You can really shave that hoof wall down to where you really got all the edges and pockets gone.
Any other questions? But here as we're getting ready to wrap up, I will just throw a link in here to our the folder on YouTube where our past recordings are. If you missed our last webinar, the Goat 101 webinar, that one has been posted on YouTube, and so you can find it at that link. And this one will be posted on the same link here in the next week or so. Anything that could help with, one more question came in here, anything that could help with pain or stress during, kind of the treatment for foot issues?
That's a great question. If you're having to isolate animals or, keep them shut up in a convalescent pen or something like that, I've, and I'm not promoting products here, but I've really seen therapy's been a pretty good tool to use. It's labeled for cattle and pigs, but I'm using it kind of across the board. And it's, helping animals be a little less stressed in confinement or group restructuring or what have you in the hospital pens. on a lot of farms for different species. As far as pain control, there is, again, nothing labeled to where we can, very easily make a blanket recommendation. But what we're going to try to do to control pain is going to be control inflammation. And our anti-inflammatory products are for food animals are going to be either flunixin or meloxicam. Flunixin being brand name Banamine, which is an injectable product, or meloxicam being an oral product. I have had some producers using ketoprofen in a specific formulation from one company. That's a combination of an antibiotic and an anti-inflammatory together. But again, we're treating inflammation and trying to alleviate pain through the reduction of inflammation. There are still aspirin products available over the counter right now. I think there's probably some value there, although I do believe the rumen microbe probably chews up a lot of that salicylic acid before it has any true effect on the animal. But it's also aimed at reducing inflammation.
And then someone asks, would it be helpful to give a B12 shot after treatment?
I'm a big fan of probiotics after any systemic antibiotic is given. B vitamins, or specifically B1 or B12 after an antibiotic treatment, it's not a terrible idea in small ruminants just because they are so much more susceptible to polio. Is one dose of it going to make a tremendous impact on their overall outcome? I'm not convinced, but if they're on a good vitamin mineral program and supplementation of feed, it's only going to be an adjunct to good management. Do I think it's necessary? No.
And then could cleaning the injection site with alcohol reduce the chance of those abscesses developing?
Potentially, yes. Anything to ensure that the hide is clean where the needle's going in may lessen your incidence of abscesses.
Any other final questions? I'm not seeing any questions. Dalton, did you want to close things out?
Yeah, sure. So yeah, let's see. Here we go. Yeah. So yeah, we want to thank you guys again for joining us for our small ruminant winter webinar series. Like Dr. Weaver said, our next one is going to be on January 9th. And so it's going to be on opportunities with sheep and solar farms. So if you're not already registered for that one, feel free to go do that. You can just Google small ruminant winter webinar series, and it's the first result that pops up on Google. We've also got one on February 6th. That one's going to be on livestock guardian animals. And then we've got one on March 6th, and that's pasture management for small ruminants. So yeah, that's all we've got for you guys tonight. And like we were said, we'll get the recording posted soon. But yeah, if you guys have any questions, feel free to reach out to us. We're happy to help in cooperative extension.